Hi everyone, and today is the most important topic, that is vitamin K deficiency syndrome and VKDS. It is also called VKDS, and that is vitamin K deficiency syndrome. It is the most common topic that all the students should know about, like MBBS student and pediatric student, and it is the one of the most common cause of bleeding in the newborn. And we have many neonates that occur in our ward or in the CS delivery or during the normal vaginal delivery. The bleeding occurs. We have to define the time of presentation. If the bleeding occurs within the 24 hours or within 1 to 7 days, or after 7 days to that is 1 week to 8 weeks, that is within 2 months. If the bleeding occurs within the early, that is within 24 hours after birth, the most common cause may be maternal intake of medications, like any either the maternal taken medication is anticonvulsant, antibiotics, or antitubercular drugs. So we have to clear it from the by asking the history. Either the mother has taken any anticonvulsant, antitubercular, or antibiotics in during the interpartum during the antenatal period, and the bleeding site is cephalohematoma, intracranial hemorrhage, or bleeding from the any site like umbilical stump while cutting the umbilical cord, and we have to consider giving fresh frozen plasma to stop the bleeding, and clinical bleed and cannot be effective by giving the vitamin K. And this is the early presentation that occurs within the first 24 hours. Coming to the classical presentation, it is called classical because it is classic due to vitamin K deficiency if we cannot give to the newborn. So after delivery, the vitamin K injection is given to the newborn so that the bleeding cannot be occur. And if the bleeding occurs due to vitamin K deficiency that we couldn't give at the after the birth, it is called classical, and that occurs within 1 to 7 days. And also due to poor breastfeeding can cause the classical presentation. And the most common site is GIT bleed, circumcision, or umbilical stump bleed. And the most commonly treated should be giving parenteral vitamin K or consider fresh frozen plasma after clinical bleed. And coming to the late presentation is after 1 week to up to 8 weeks, and the late presentation is most commonly due to the systematic cause coming in the newborn, that is fat malabsorption syndrome, or biliary atresia, or that is alpha-1 antitrypsin deficiency, or any liver or gastrointestinal disorder, or sepsis. And most common site is GIT, mucocutaneous bleeding from the skin, or bleeding from the intracranial hemorrhage, or bleeding from the eyes, ear, nose. And most common treatment is giving parenteral vitamin K, and consider giving fresh frozen plasma if the clinical bleed is present. And so after discussing this, we have to keep in mind that only three most common cause of bleeding occurs in the newborn, that is early, classic, and late. And early occurs within the first 24 hours after birth, and classical occurs 1 to 7 days, that is within 1 week after birth, and late is 1 to 8 weeks, that is after 2 months. And if the bleeding may be any cause, we have to consider giving fresh frozen plasma or vitamin K. And if the bleeding occurs within 24 hours of birth, within 24 hours after birth, the vitamin K is not considered effective, and so we have to give fresh frozen plasma. Thank you.